Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sling surgery. In sling surgery, it supports the uterus and the cervix. Sling surgery is mainly the material of sling is merceline tape. Indications of sling surgery are congenital prolapse, that is young and nulliparous females with prolapse, or if there is young female with prolapse who is planning to conceive in future. In them we do sling surgery. Types of sling surgery. First, we have anterior sling surgery. In anterior sling surgery is attached to the one end of the sling is attached to the anterior part of the isthmus, whereas the second end is attached to the rectus sheath. This is called as dynamic sling, and here the female should have a good abdominal tone. It is called as dynamic sling because rectus sheath moves voluntarily with us. So when we move the rectus sheath or abdominal wall, then this sling also moves. So it is a dynamic sling. So for this anterior sling surgery, we need to have, the females should have a good abdominal tone. Complications of anterior sling surgery.
In anterior sling surgery, anterior end of the isthmus is connected to the rectus sheath. This rectus sheath is mobile, so it is dynamic sling. So complications.
Are less, and success rate of anterior sling surgery is also less. Examples of anterior sling surgery is Purandare's sling. Second, we have posterior sling surgery. In posterior sling surgery, one end is attached to the posterior part of isthmus and the other end is attached to the ligaments of the sacrum. Here, the posterior sling is actually a static surgery. Static sling. The complications of the posterior sling are more and success rate is better. Examples of posterior sling are Sirotkar's sling is mostly done these days, whereas Khanna's posterior sling is not done these days.
So here the posterior part, this is the anterior wall, this is the posterior wall. So posterior wall of isthmus is attached to the sacrum, ligaments of sacrum, that is posterior sling.
Now, complications of Sirotkar's sling. In Sirotkar's sling is most commonly seen on the left side. The complications are include abdomen of complications of the Sidotkar sling are mainly seen on the left side. So on the left side, the Sidotkar sling will cause obstruction to the sigmoid colon. It can cause injury to the mesenteric vessels, resulting in ureteric injury, or it can result in genitofemoral nerve injury. So these are the complications of Shirodkar's sling. Then Vikrut or Virkud or composite sling. Virkud or composite sling. Virkud or composite sling, that means on right side if you do Shirodkar sling and on the left side if you do Purandare sling, then it is Vikrut or Virkud or composite sling. Khanna's posterior sling operation. In Khanna's posterior sling operation, in this one end is attached to the posterior part of isthmus, the other end is attached to the posterior superior iliac spine. Case 6.
So in Khanna's sling surgery, in the one end is attached to the posterior part of isthmus, whereas other end is attached to the posterior superior iliac spine.
thank you and thank you for watching.